prenatal care, and any barriers or challenges to documenting. And so we just thought it would be helpful for those who aren't able to join today to record and then be able to post at so if folks wanted to watch at a later time.
Yes. Hi, Allison, and hi, everyone. Good afternoon. I've just started the recording, so hopefully it will be a useful resource for anybody who's not able to join or anyone who wants to listen again.
We still have a couple people joining, so we'll just give it another minute. It's just 12:30 now. So welcome everyone. Thanks for joining us today to talk about prenatal appointments. And for those that are just joining, we shared that it is going to be recorded, just for those that could not join that might be interested in watching later on and posted. And also is interactive. We want to hear from you in a little bit too. So hopefully you'll all feel free to share your thoughts and experiences.
Hello.
Yep, we're here. We're just waiting a couple minutes, just letting folks join, and then we'll get started. All right. I think that we'll go ahead and start. Good afternoon, everyone. Welcome to the Prenatal Care Lunch and Learn. I'm Allison Contento from the New York State Office of Children and Family Services, and also the Healthy Families New York Program Coordinator. And I'm joined today by Miley Ray from the Center for Human Services Research. So I'll let Miley introduce herself.
Everyone, yes, I'm a senior research scientist at the Center for Human Services Research. And after we have the discussion with Allison about why prenatal care is so important for moms and babies, and that documenting it is important, I'm going to be showing you some new features we've put into the MIS. I'm going to walk you through those so that hopefully that will help FSSs and supervisors keep better track of prenatal care in the future. And thank you for all joining us. We have 126 people on this call. That's amazing.
No, that's great. And so for those that didn't hear, we are going to be recording just for anyone who wants to go back and listen, or maybe they weren't able to attend and want to listen in. And also, we do have a little bit of time to be able to hear from you all around your experiences with any barriers or challenges for families to receive prenatal care, and then any barriers or challenges to documenting in the MIS. So we'll get started. I'm going to go ahead and all right. So, so prenatal care, just probably nothing that you all don't already know, but prenatal care is important because it does help prevent complications and informs women about the important steps that they can take in order to protect their infant and ensure a healthy pregnancy. So when there is regular prenatal care, we know that it can reduce the risk of pregnancy complications. Um, Prenatal care does monitor the mother and the baby's health by doing things like weight checks, examinations, ultrasounds, etc. And prenatal care can educate women on health and safety, diet, talking with them about ensuring that there's regular exercise as it's advised by their healthcare provider. And then also those conversations around and information around avoiding any potential harmful substances. It also can help control any existing complications or health conditions that a mother has, such as high blood pressure, diabetes, et cetera, to be able to prevent serious complications during the pregnancy or birth and any effects thereafter. Prenatal care also reduces the baby's risk for complications. So prenatal care can provide education on ways that a mom can prevent risks to the baby, such as tobacco, smoke, alcohol use during pregnancy. So similar to the topics that we talk with our families about in terms of risks associated with utilizing any of those substances or tobacco during pregnancy. It also can help ensure that any medications that a woman is on, that they are safe. So, prenatal care can educate women on both over-the-counter and prescription medications that they should avoid during that pregnancy to reduce any harm that they can cause to the baby. So why do we track, or why is tracking prenatal care important? As you all know, that Healthy Families New York is an evidence-based home visiting program. So in 2000, Healthy Families New York started a randomized control trial to be able to look at different outcomes of the families that participated in Healthy Families New York. And so one of the most important ways that we were able to show that evidence-based home visiting model was by looking at the data that's collected by the home visitors. And specific to the findings of the randomized control trial, we saw that Healthy Families New York home visits had an impact on reducing low birth weights, which meant or means healthier babies. And we know that, typically when mothers are receiving prenatal care, there are better outcomes for the mother and the baby. And so by home visitors sharing information and supporting families to ensure that the mother is receiving the care that they need, again, it does have outcomes on the health of the mom and the baby. And so we want to track if moms are receiving prenatal care and also if they're not, and the reasons why they wouldn't be receiving care. And so it can be helpful for both the home visitor and the program in supporting the family with strategies to potentially overcome some of those barriers for families in receiving prenatal care. But it also can be helpful for us. In central administration and even at the state level to be able to share that information broadly. Things such as when there's communities that have no or little prenatal care available to the families, it's good for us to be able to look at that in the data and then share that information outward with other partners throughout the state. And one of the primary goals of Healthy Families New York is positive outcomes for maternal and child health. And so ensuring that mothers are connected to prenatal medical care helps us meet that overall goal. And then, of course, always going back to the outcome for the families and why are we encouraging and assisting and supporting families in receiving medical care, because again, we know we're evidence-based that when we're providing that support and information and helping those families make those connections when possible, that we do get those outcomes for the families, such as better health outcomes for both the mom and the baby in this instance. So this is where, oops, I'm going to stop sharing because I want to be able to write in here what you all have to share about so that we can save what that feedback is from you all. What the challenges are or the barriers are for families in receiving prenatal care. So we'll open it up for those who want to share. You can share if you're not comfortable talking out loud, you can share in the chat. Or you can go ahead and come off mute and share verbally as well, whatever you're comfortable with. So I see transportation being a big barrier.
Just knowledge in general
Of the family, like of what's when you say
of
knowledge,
having of have knowledge of like having that they should get the care, the prenatal care.
all right, we got a
We have a
lot.
lot of people saying a limited number of doctors in the
Mhm.
Indiana area, a lack of
Yeah.
available appointments, language barriers, insurance or Medicaid, domestic violence and control by someone in the home.
I've only
Mhm.
worked in this program for a couple months. I've just started connecting with families over the last month and a half or so, maybe 2 months. And one thing that I have heard from all of them is when they go to their prenatal appointments, they're always seeing a different provider. And it's not preventing them from going, but
Mhm.
it kind of puts a barrier in creating that relationship and trust.
Mhm.
Also, I had noticed in the office hours, let's say 9 to 4, 9 to 3,
Yeah.
and family that they either work, go to school, and all of that. So there's not much flexibility on that end.
Mhm.
Some also have like substance use problems and they might be afraid to go for that alone.
Yeah. Miley, can we save the chat? Like I'm trying to write what's in here, but it might also be helpful in case I miss anything. So
Yeah.
and then also just to kind of look back at like um I'm sorry, look back at maybe some of the themes or trends, like what seems, from what folks are saying, what seems to be some of the ones that are coming up a lot for families. So,
Yeah, absolutely.
um,
I've been taking notes too, and I do plan to
okay.
save the chat, and we can add some of these. We've added some new MIS features that I'll be sharing with you later,
Yeah.
and we'll add some of these ideas that you are all giving to those MIS questions as
Okay.
response
Yeah.
answer.
All right. So I'm going to briefly summarize just in case. And we'll, like we said, if I missed something, we'll go back to the chat and look, but just in case there were other thoughts. So we saw transportation a lot, childcare, lack of medical providers, lack of knowledge on the part of the family, language barriers, domestic violence or control, insurance issues, living in a rural community, homelessness, depression, unstable housing, office hours, judgment from the provider, fear, cultural beliefs, substance use, their work or employment, or lack of flexibility with that. The provider discharged the family and hiding their pregnancy. These are really good. Anything else? See lots of. I just have a question that's not necessarily related to the barriers, but for those that were putting in like lack of knowledge from the parent, if you're sharing information and having conversations, does that help the parent or the mom then try to make those connections?
I'm connected with a mom that
Mm-hmm.
she was sick, and so she missed her prenatal appointment, and she was afraid to contact her doctor because she thought she'd be in trouble for
Mm-hmm.
missing that appointment. Um, but after talking with her a bit, like, and how her being sick can have, effect on the baby, and her, um, she did call and reschedule an appointment. And as far as I know, things went smoothly. So I think just our encouragement and just giving information um is really helpful.
Right.
I think it depends on the what the concern is. So, like if it's something as far as educationally, there are things that we can do as workers. However, if it's something concrete like fear of deportation or childcare or transportation,
Sure.
things like that, we're very limited on
Mm-hmm.
what we can actually do about it.
Right.
I do try to encourage, though, if some appointments can be like a tele appointment because that can help with some of the issues around childcare and transportation, but not all appointments can be tele appointments.
Right. 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 Great point. Mhm. If you think of other things, you can certainly add to the chat. Like we said, we will save that so that we can take a closer look at some of the ones. And then we're also taking, I'm sorry, taking notes, um, on what you're sharing. All right. So the next is what, if any, barriers do folks find in the actual documentation of prenatal care? So in terms of the MIS, any barriers or challenges that you all find um, in trying to document the prenatal care appointments?
One thing that I find is as far as options to choose of what the prenatal appointment is. So like I've had several moms that it's not just like a basic prenatal appointment they have to go to, but it is in connection to the pregnancy, like women who have had heart problems during their pregnancy, people who have had to go in for glucose monitoring uh during it because they're having prediabetes or already have, pregnancy related diabetes. So I think it's just like, and also the excessiveness of some of my moms just have their basic appointments, but because some of them have so many other issues going on, just keeping track of all of their appointments because there's so many if they have other complications.
Thank you.
Hi there. I feel like we did a better job capturing prenatal medical appointments when people were consistently using like the paper form for the PC1 med and the supervisor was reviewing it on a regular basis. Now that we've kind of gone paperless a little bit with a lot of our processes. I feel like that process kind of fell to the paperless side of things, and maybe not having that paper around makes a big difference for folks.
Thank you for that. So maybe like just, um, yeah, like that whole change in process, like you said, going from like one way that you did things to a different was a little bit of a hiccup.
Yeah, listen, also think for documentation purposes in the health tabs, there should be some type of not warning, but a highlight or something letting us as home visitors know like certain criteria needs to be met in those prenatals. For us right now, I feel like we're kind of guessing. We're kind of going over it
Mm-hmm.
with provision saying, did I get SIDS? Did I get safe sleep? Did I get all this stuff? Or maybe if it was an MIS with a little, hey, remember this kind of thing,
Yeah.
it might be better documented.
Yeah, and we actually have added some features like that, so I'll be discussing those in a little while. So hopefully that will be helpful, but I also would welcome any other input that you might have if ways that you think we could improve the features even further on the MIS.
If it was somehow connected to the home visit log, I think just home medical visits in general would be so much easier than going into a separate spot and remembering to do that.
Yep, and we've just done that too, so I'll be sharing that shortly. So hopefully that will be helpful.
Oh, great.
Perfect. Thank you. Any last thoughts on that? And again, feel free to keep adding to the chat if something comes up for you. Um, all right, Miley, I'll turn it over to you so that, thinking about some of the challenges folks shared, you can share some of what has been done to try to help alleviate some of that.
Yeah, so we've been working hard to try to make the MIS a little bit more helpful in terms of documenting prenatal care visits. So we've added some new features to the home visit log. We've added a new feature to the forms page on the case page. And we've also added a new item on the quality assurance or QA report. So I'm going to share my screen now and start to show you some of these features, and feel free to interrupt me at any point if you have questions, and we can also, after I finish, we can discuss any questions further. So I'm showing you some data from the test site. So it's important to know that this is all fake data. So nobody's confidential information is being disclosed. These are all fake people. Now, this is a dashboard for a worker, Barbara Handler, at a program called Healthy Families Woodstock, which is a fake program, as you know. So if you come down here and you look at active cases, you'll see that here's a case, Donna Page. She's level 1 prenatal. And another case, Gwen Brooks. She's also level 1 prenatal. Now I want to click, you can go right from the dashboard, you can click right onto that case. Most of our home visitors know how to do that. That brings you right to Gwen Brooks's homepage. Now, if you go to the Forms tab, you can see this there. Here are the home visit logs. So I'm going to click on home visit logs. This state case only has one home visit log entered. Now I'm going to show you, I'm going to enter a new home visit log. So I go to new home visit log, I have to enter the date, and I'll submit that, and that brings me a blank home visit log. So you know there are several required fields right now on the home visit log, and there are a lot of others that are not required. If you go to the Health of TC and PC1 tab right here, the fourth tab down, it shows you first, it gives you some health questions about the target child, appears healthy, immunizations, etc. Then it gives you some questions about the parents or other caregiver, health concern, tired or irritable. Then there's this new question that we've put in, which is now a required question on the home visit log, receiving prenatal care. So you won't be able to submit a home visit log anymore without answering this question. So the answers, there's just a drop-down menu. You can respond yes, no, or unknown to whether mom is receiving prenatal care or not. So let's just say I'm entering this home visit log and I know that she is receiving prenatal care. I'll click on yes. This automatically gives me this link right here, this blue link that says open the PC1 medical form in a new browser tab. So that's going to open it in a new tab. And so it doesn't close out your home visit log. So you can go ahead to open it, and I'll show you that in just a second. But we do recommend that you save your work before opening the PC1 medical form, because it's still possible that your home visit log can time out, and then you would lose your work. So you want to scroll down to the bottom of this page here. And at the bottom here where it says, on bottom left where it says save partial, you'll want to click on that first, just to make sure that all of the information you've already spent a lot of time documenting gets saved. Then you can click right here on open the PC1 medical form if PC1 is the biological mother, which in most cases for prenatal cases, PC1 is the biological mother. So I click on that. It brings me to the PC1 medical form page. You can see this is a new browser window. And here is the plus new PC1 medical record right here. This is where I enter the new PC1 medical record. And I just want to point out it's really easy to enter the PC1 medical record. All you're required to enter is the type of visit and the date. And that is all. There are no additional notes. There are no other questions. So it's pretty quick. You just want to know from mom what day was the visit. So let's say I know she had an OBGYN visit last Wednesday. I just look at my calendar, see what the date was for that. If you click on the calendar, it brings up a calendar for you, or you can just write in the date. And then here, the options for type of visit are OBGYN checkup, primary care visit, emergency room visit, or urgent care visit. Now, I want to point out that only an OBGYN or a primary care provider visit count as a prenatal medical care visit. Emergency room visits and urgent care visits do not, because we're really trying to get mom to have regular care, not to be using the emergency room or urgent care for her prenatal care visits. Okay. So I'm just going to cancel out of that, and I'm going to go back to this previous tab. So this is what happened if I answered yes to the question receiving prenatal care. I can also answer unknown, and then that counts as answering the question. Now it gives you a reminder that you need to try to find out. We don't want it to be unknown, but you can click unknown and then still submit your home visit log. Now, what if the answer is no? She's not receiving prenatal care. You know that. You've talked with her, and for one reason or another, she's not doesn't want to receive it, or it's not possible for her to get to those appointments. So if we click on no, another question appears. Reason not receiving prenatal care. And you click on the arrow here, and here's a drop-down menu. And these are some reasons that we thought of that are reasons that mom might not be receiving prenatal care. Now, you all have just shared a lot of really helpful reasons, and we're going to add those to this drop-down menu. So it's going to be a lot longer. It'll have all of the things that you suggested. So right now we have family can't afford it, lack of prenatal care providers in the area, family can't get to prenatal care appointments due to transportation issues, family can't get to prenatal care appointments due to employment conflicts, family has other children and doesn't have childcare. You all shared a lot of other really great reasons that we didn't think of. So that was one thing we were hoping to get out of this lunch and learn. So that's great. Now we'll be adding those items. Allison and I and some other folks at Central Administration will add those items to this. This, by the way, has not gone public on the live site yet, but it will probably go public on Friday. And then there's also an option for other please specify. So even after we add all these extra possibilities, if the answer is other please specify, if you have another reason, you can click on that and then a text box opens right here, select reason for not receiving prenatal care. Okay, so that is the new feature on the
I have a
home visit
question.
log.
I
Oh,
have a
yes,
question.
sure, go ahead.
What if you're not dealing with a prenatal mom? What if you're dealing with a mom that has, already, the baby's already been born? Are we going to have to answer this every single time and then click other and then specify why?
No. Oh, sorry, I should have mentioned that. So this only shows if the home visit log date is before TC's due date. Okay, so once TC, if you have a home visit log the day after TC's due date, that is not going to show up this question won't show up anymore. It just goes away. It's just built and it's only for prenatal visits.
And Miley, there's a question in the chat about subsequent pregnancies and whether we'll be tracking this for subsequent pregnancies.
We are not currently tracking it for subsequent pregnancies. We're currently only tracking it for TC. That's something we could consider. It might be more difficult to implement just because we don't track subsequent pregnancies in general as well in the MIS as we do. Our focus is usually on the target child.
Yeah, and I think Ben responded to that from CHSR. So only required when the mother is pregnant with the target child.
Right. Yeah. Okay. Yeah. Thank you, Ben.
Miley, I had
you
a question too.
Oh, yes, please.
So you said that the question stops at the child's due date, but sometimes the baby isn't born at the due date that we have in the system. So what happens with prenatal visits that happen after the child's due date?
That's a very interesting question. I think if Ben is on the call, maybe he can answer how that is. I think what will happen is it will not appear.
So, yeah, that's a good question. And we've had a couple of tickets prior in regards to other questions that are related to the TC's due date and whether or not the home visit was completed on or after the due date. In general, the system is only knows the due date itself, so it bases all its calculations off of that. So currently, if you had a home visit after that due date, it sees the child as born. If you have a case where the due date gets extended, we recommend that you update the due date. And I will note that we do not save the due date. This was a concern from one of the tickets. We don't save the due date in the MIS after the child's born. So it's not like we're recording that the child went 2 weeks over their due date, except via the gestational age on the TCID form. So I would say in general, if you're concerned about that, and if it happens, you should update the due date to the new due date if there is one, or I guess try to estimate. I don't like saying try to estimate it, obviously, because we're not doctors, at least not most of us, I don't think. But in order to get the question to show up on the home visit log, the due date must be after the home visit log date. I guess that's the answer.
Okay, great. Thank you so much, Ben. That's really helpful. Does that answer your question, everyone? Heather?
The due date,
Yes.
is that something the supervisor does? Is that something we can do?
It can be done either by the FSS or the supervisor on the basic case information tab. If you click edit information, it will let you update the due date to whatever the correct date is.
Okay, great. Thank you so much. So now I want to go on to another. Oh, go ahead. Another question. Sorry.
So what happened? I'm sorry, give me 1 second. What happened when you select yes, but the family didn't get a visit on the time that after you sold the family?
If you select yes, you get the option to enter a PC1 medical form. It doesn't have to be the date of the home visit log. It could be a month in the past. It could be 2 weeks in the past. That's fine. You can still enter the PC1 medical form. You can go right here and you can enter any date right in here on the PC1 medical. So the date doesn't have to be the date that the home visit log is on. Those can be two totally separate things. Does that answer your question, Mariella?
Yes, it did. Thank you.
Okay, great. Now, does anyone else have questions? This is great that we're getting so much participation.
I have a question, kind of going off of the last thing. What if she had an appointment, but you logged it in the last one and maybe she missed an appointment since this home visit, but she's receiving care in general, would you still say yes? And then what date would you put in if you've already done that in the last one?
That's a good question. I think if she missed the appointment should be deleted, and you may need to reach out to IT to submit a help ticket. Ben, is that something that IT can handle to delete?
We can, and it can be deleted by FSSs if it's not approved, supervisors if it is approved. I believe though that you're only supposed to enter appointments that have occurred. I don't know if it'll even let you enter future dates. I'd have to double check that. So, for example, I couldn't enter an appointment for the 15th right now, I don't believe.
Oh, okay, great.
You enter them after they've occurred.
Okay, are there any other questions about this feature?
I have a question.
Sure.
It's still going along with documenting the actual date. So once you put that they're receiving prenatal care and you mark yes, if there was no um scheduled appointments prior to your visit, do we just skip putting in a date, or are we supposed to put in a future date
You can
of
just
their
skip
next
it.
appointment?
You can skip
Okay.
it until they've had a visit, and then you go ahead and enter the date.
Okay, thank you.
Okay, so you're not, if you answer yes, you're not required to fill out the PC1 medical form. It's the link is right here for you to make it easier than it was before, just so that you can go right to it, quickly put that in, and then go back to your home visit log and finish documenting your home visit log. But you can always come back later, go to the forms page and go to PC1 medical information and document that new date whenever you have it. Any other questions? Okay, so I'm going to go on to, I'm going to show you another case. And this is in direct response to a suggestion someone had. So this is nice. This case is Donna Page. She's also on level 1 prenatal. If I go to the forms page, you can see here PC1 medical information is highlighted in orange. That is because the case is prenatal as of today. She was prenatal as of enrollment. The answer to the receiving prenatal care question was either yes or unknown, but there have been not any PC1 medical visits documented on the PC1 medical form in the past month. So that means PCP visits, primary care provider, or OBGYN visits. There are none of those documented in the past month. So this is highlighted in orange to let you know that you need to enter a PC1 medical visit here. And if you hover over this, it gives you this nice little message, PC1 medical information, attention required, and it gives you the description. No PC1 medical visits have been entered in the past month. The most recent complete home visit log indicates that the PC1 is either receiving prenatal care or receiving prenatal care is unknown. So if you know she's receiving prenatal care, you want to try to find out when she had her visits in the past and try to document as many as possible. If it's unknown, this is just a reminder to you that you're supposed to be asking about that. That's a question you'll want to make sure you ask mom at your next home visit with her, so that you can start following and tracking this information and making sure she is connected to prenatal care for all of the reasons that Allison was discussing, for why it's so important for moms and babies to be connected to prenatal care. Are there any questions about this item? Okay, if there are no questions about this, I'm going to then move on to a report that we've done, which should help you, which should help both FSSs and supervisors alike in keeping track of these prenatal medical care visits. We realize, obviously, you have a lot on your plate, and it's difficult to keep track of everything that you have to do. We hear that all the time from home visitors, that documentation is such a burden. So this is to try to help make it a little bit easier. So if you go to the reports tab right up here, it's just going to take a second to pull up the reports. Okay, so you can see I've already pulled up the quality assurance report, but I'm going to delete this for a second. Here's a list of all the reports. In the search box in the top left, if you just type in QA, that's the abbreviation for Quality Assurance Report, it brings up the Quality Assurance Report. You click on this and you just click Run Report. And this has a lot of useful items for supervisors and FSSs to keep track of what's going on with their cases. Now, if you see at the very bottom here, there's this new item that we've added. This already is on the live site. Active prenatal cases with 0 prenatal medical care visits in the last month. So since we're in January right now, it's giving me the no's with 0 prenatal medical care visits from December 1st through December 31st, 2024. So if I click on this link, it gives me this nice list with a lot of really useful information on it. It gives me PC1s, all the PC1s names. So if you'll recognize the name of your family, if you're the mother that you're serving. It gives you PC1's ID. It also gives you some other useful information: her intake date and due date, her current worker, her current level, the current level date, and whether she had prenatal care on her screen into HFNY. And so FSSs can use this. They can look under current worker and say, okay, these first 2 cases by Barbara Handler, the ones that I just showed you, Donna Page and Gwen Brooks, these 2 cases need attention. And then if I'm a supervisor, I can say, okay, I'm meeting with Barbara. I want to talk to her about why Donna Page and Gwen Brooks don't have any PC1 medical visits documented. What's going on with that situation? Is there anything we can do to connect this mother to care? Or is the mother already receiving care and we just don't have the information yet to make sure to ask mom about that, about those dates? Like you can see here for Quinn Bailey, this worker, Quinn Bailey, she has a lot of cases with no prenatal medical care visits in the last month. So during supervision, you can go through and discuss all of these cases. Now, one thing that's really nice about this report in general, this is a very useful report. You can see I'm just highlighting PC1 ID. I can click on this PC1 ID. I can click on Donna Page. Let's say I know she did have a PC1. She did have her OBGYN visit last Wednesday. I want to enter it. I just click right here on her PC1 ID. It brings me right to her case page. Excuse me, I apologize. I'm recovering from the flu, but then you go to the Forms tab, and there it is, PC1 medical information. You just click right on PC1 medical information, add a new PC1 medical record. Excuse me, just fill in the type of visit, OBGYN, click on the calendar, enter the date, and then click submit, and you're done. And if you say you have 5, it'll allow you to just keep entering more and more visits until you have everything documented that you're aware of. Does anyone have any questions about this report? Any suggestions on things that might help that make this report more helpful for you?
I have a question. It's not necessarily about this report, but I do know that somebody mentioned one of the barriers in the way of documenting these prenatal care visits was the lack of options. And I know it's just the four there. It was like the primary care doctor visit, the OBGYN if it was a checkup. So somebody was like, oh, they went to see their OBGYN, but it's not for a checkup. I just was wondering if you were able to add more reasons to that list or if that's how it should stay.
I think we could remove the wording checkup. I think
Yeah,
we just mean OBGYN there. We could remove the wording checkup. If so
okay.
you're saying maybe like there was more of an emergency or something. It wasn't just a regular checkup. She went because she was bleeding or something like that, or leaking amniotic fluid, something like that. Yeah. So we could just remove the word checkup. I think
Thank
that's
you.
easy change. And I just want to note again for this QA report, just like for where the orange was highlighted on the PC1 medical form, we only count PCP visits and OBGYN visits as prenatal medical care visits. We don't count anything else. So, you know, if mom went to go see an orthopedist or something because she sprained an ankle, that doesn't count. So that's probably part of the reason it's not, that there aren't more options on the MIS for those. Does anyone else have any questions or suggestions for us?
Yes, Miley, I have a question. I'm wondering on this QA report if it's only tracking prenatal care from screen. Does it update if we're adding it after screen?
Yeah, it's only tracking prenatal care from enrollment date. It doesn't track it from screen. The reason we put on here whether or not she was receiving prenatal care on screen is because like if you know the mom was receiving prenatal care before she enrolled in HFNY, it's likely she's still receiving prenatal care. So maybe then you really want to make sure that you document it because like you probably know she's getting it. Or it would be alarming if she suddenly stopped getting it. You'd want to know what happened there. Did she not like her doctor? Was there a conflict? Is it, now she's having work conflicts and can't get to her appointments or whatever the case may be. We just thought that might be interesting information to have, but this is tracking it only from enrollment date, not
Okay, thank you.
grade date.
Okay,
Sure.
thank you.
I have one question.
Oh, sure. And then Heather
If
has her hand up after you. Go ahead.
if the if say the mom, she's getting prenatal care, and she has to go to the hospital because say she has like forced labor or something like that, or she goes to her doctor and the doctor says that still wouldn't count as a prenatal care visit. That would just be like an emergency room visit, even if it did have to do with, and then say she got sent home or whatever, it wouldn't be under a prenatal visit.
Well, that's a really good question. I mean, in that case, it really does sort of seem like it should count as a prenatal care visit. The way we have it set up right now, it doesn't. But maybe that's something that we'll discuss and see if we can add that. The problem is that would be an emergency department visit, right? And we don't want to count, like, the problem is with emergency department visits is we don't want to count it if mom broke her ankle. We don't want to count that as prenatal care because it's not, obviously. I mean, maybe the doctors will have asked her some questions about her pregnancy, but it's not really prenatal care. I guess the best thing to do in that circumstance would be to document it as an OBGYN visit because she did at least go to her OBGYN first. Heather, go ahead. I know you have your hand up.
So my question is sort of related, but let's say we have a mom who's a high risk pregnancy and she's hospitalized for a portion of her pregnancy due to their, watching her for whatever reason. Um, uh, we're going to answer yes that she's receiving prenatal care, but I mean, what do we put in for her visits with her OBGYN. She's potentially seeing them daily, and that would be kind of silly to document it that way.
That's a really good question that we hadn't thought of.
Miley, I don't know if you were seeing some of the other things in the chat in
No.
regards to like when it's a midwife or a doula, like to me, I feel like that or Planned Parenthood, like uh, to me, I feel like if that the purpose of the visit is for prenatal care, I don't think it necessarily needs to be specifically like an actual OBGYN physician if that's the care that the mom is. But I don't know if, and then Emily Giragenti had said, which I thought was a good idea. I think other people do too, like calling it a prenatal encounter than rather than OBGYN visit. So that way it's all encompassing, like if they're receiving prenatal care. But in terms of like the data and the MIS, like, um, do we need, like, does it need to be OBGYN? I
That's
mean,
a
to
really
me,
good question. I think we should discuss that further. I mean, we
yeah.
can certainly add, that makes a lot of sense to me to add the options midwife and doula
Mm-hmm.
as separate
Yeah.
items because that should count
Yep.
toward prenatal care.
Correct.
Whether we want
Right.
to say Planned Parenthood is an OBGYN, so that would count as an OBGYN visit.
Mhm.
But whether we want to just say prenatal encounter, then we lose the specifics about what type of doctor. So it might be better to try to
To have the other options so
try
that
to
you could check
decide more
who the
options.
care is being provided to. Hmm.
Yeah, I think we can definitely add the options midwife and doula. Are there other options folks are thinking of that we should be adding? Okay. Nora, I know you have your hand up, and then we'll go to Kara, who also has her hand up.
Two things. A doula providing any medical care, so they should not be on the list as a medical care provider. That would be a major red flag to refer someone to prenatal care. But another thing, I like the differentiation of which provider is providing the prenatal care. Like I get we might want to call it a prenatal care encounter, but I like the idea of indicating somewhere, whether it was an OBGYN or a midwife. I'm just thinking like down the line, if we do further research or if we have CQI projects around like who's engaging in care and what types or what model of care they're engaging in, that information would be helpful to pull to be able to have later on. Just a
So maybe it's possible we could add we can add an item like prenatal encounter, and if you click yes to that, then a drop down option will appear OBGYN, PCP, midwife. Now you were saying, Nora, that you don't think a doula should count as prenatal care.
No, a doula is a non-medical support professional, so they should not, it is not within the scope of a doula.
Okay.
As someone who is a doula, that would be a major red flag for me. Now,
Okay.
you might see a doula in addition to your midwife, and they might be there supporting you emotionally through your prenatal care appointments, but they should not be providing prenatal care.
Okay, thank you so much for that. We'll
I
take.
just also like, we will save the chat and go through this too. And I just want to think about the home visitors tracking and trying to keep in mind that we are not getting a lot of information. So I want to be mindful about the amount too that we're going to then potentially like, I guess like think through what do we need, right? And like just to keep that in mind because we're having trouble tracking it. And so if we add like a bunch of different options, it may make it more challenging for the home visitor, like spending more time trying to document so I just wanted to put that out there too.
Yeah, that makes a lot of sense. I mean, it might be better not to have a prenatal encounter option and just to add midwife.
Yeah, I think we should talk about what it is specifically that like just what do we need and like the best way to get that to and then to keep it straightforward for the home visitors too. Like, what do we want them to track? Like, kind of going back,
Yeah, I think that's a very good idea. Thank you, Allison, and thank you, Nora. Kara, do you want to go ahead, and then I see Walter, JC, maybe you could go next.
Well, I have two questions, and I don't know whether this will fit, but we're looking at the list. What about a visiting nurse? Because some people do have visiting nurses that come to visit them and actually do prenatal care stuff with the pregnant mom or pregnant family. Just as a thought. And then the other question I have is, we have yes on this list that we're looking at. Is this list all encompassing of whether they have prenatal care or not? Because I'm looking at this quality assurance report as a report that will say, these are the areas or these are the cases that we need to do something with, versus a yes says they're already doing it with the family, like it's already documented that they're having prenatal care.
This list here on the quality assurance report is cases who have no prenatal care documented in the MIS in the past month. So these are the cases you need to do something with.
So if you come down to the Cullen Bailey, there's a yes in that section, in that column.
Oh, on the last column, you mean?
Yes, so that's why, am I reading the report wrong, or?
That column, if you look up on top here for the header, it says prenatal care on screen. So that's whether she had prenatal care, but when she was screened to join HFNY before she was actually enrolled. That's her screen, that short screen form. So this woman did have prenatal care at her screen, but she has no prenatal care documented in the MIS since she's been enrolled in HFNY. So that's what that means. Does that make sense to you?
Yes.
Okay, great.
And then Jana had her hand up.
Okay.
Hi. So I'm a doula and also run a home visiting nurse program and have a long history in maternal child health. So a doula, as already described, cannot provide medical care. The nursing visits for home visits, if they're getting their home visits, a nurse visit, that gets reported back to an MD, but it can't take the place of prenatal care. So a person can't just see their home visiting nurse and not see an MD, a nurse midwife, or a nurse practitioner. So nurse practitioner, MD, nurse midwife would be the providers the RN can report to. My concern would be kind of saying in a clinic or an MD setting, putting that in there, because there can be a nurse visit only in a clinic office or an MD office. So let's say a girl has gestational diabetes. She might be going to a prenatal visit where they're doing her vital signs, they're doing her weight, they're using a Doppler, and an RN can do that to do the assessment, and then they're doing blood work and diabetic teach. She might not see the doctor or nurse practitioner or a PA that day. She might just see the nurse, but that's still counted as a prenatal visit in that office setting. So it would have to be in an office or clinic setting.
Oh, okay. Thank you very much.
Yeah.
We can make a note of that and when we're revising these options. Does anyone else have any questions or suggestions or areas of confusion? Oh, I have someone wrote in Eileen wrote in the chat, but saying setting, does that include telehealth visits?
In a telehealth visit, it's challenging because there's no vital sign assessment. There's no assessment of fetal monitoring. So that's usually an education visit. It depends on how you want to count it.
Yeah, I'm not sure. We'd have to discuss it, I guess. I don't know.
Yeah.
And if you have any thoughts on that right now, or we can reflect on that further.
It might be a medication teach.
Mm-hmm.
That's challenging.
I mean, it could be a consultation about nutrition and,
Right.
substance use.
Right.
So that would still be helpful, but maybe there wouldn't be an ultrasound and there wouldn't be blood pressure monitoring, as you said, or
weight checks or
weight checks. Yeah.
exam. you know.
Right.
Yeah.
Yeah.
Good, good, good. I know we got 2 minutes left. This was super helpful. So we'll go back and take a look and make some updates based on the feedback that we got, and make some decisions around how we can best capture without overwhelming already overwhelmed home visits on what it is that we're looking to collect in terms of documentation. But we appreciate everyone taking the time today to join us and share openly all your thoughts and ideas, as always. Super helpful, and we appreciate you. So thank you. Enjoy the rest of your afternoon, and talk to you soon. Thank you.
Yes, thank you all very much for joining. It's been a really interesting conversation, very informative for us.